Dental implant surgery is a procedure that replaces tooth roots with metal screw-like posts and replaces damaged or missing teeth with artificial teeth that look and function much like real ones. Dental implant surgery can offer a welcome alternative to dentures or bridge work that doesn't fit well and can offer an option when a lack of natural teeth roots don't allow building denture or bridge work tooth replacements. How dental implant surgery is performed depends on the type of implant and the condition of your jawbone. Dental implant surgery may involve several procedures. The major benefit of implant is solid support for your new teeth, a process that requires the bone to heal tightly around the implant. Because this bone healing requires time, the process can take many months. In dental implantology, the force used to insert dental implant is called insertion torque. It is the amount of force required to advance the implant into the prepared osteotomy, and it is expressed in Newton centimeter units. The optimum torque for implant placement is considered 23 to 35 Newton centimeter. Hence, the optimal torque value for placement of implant is in the range of 23 to 35 Newton centimeter. This data is supported by the ITI treatment guide, which states that the minimum torque value for implantation protocol with immediate loading should not be less than 35 Newton centimeter. A drill speed of 2500 rpm with a force of 2 to 2.4 kg seems to be good enough for osteotomy preparation in very less time with less heat production, and also requires less time for bone to attain normal baseline temperature. The relationship between heat generated and implant drilling osteotomy is multifactorial in nature, and its complexity has not been fully studied.